I think the country fundamentally has to decide if we're adopters or innovators. Sometimes I worry that we step back and say, well, let's see what everyone else is doing. But is that the position we want to be in? Because if we're not, and we want to be innovators, we have to have the courage to say it's okay to get it wrong. We're going to have proper safeguards and guardrails and such, of course, but it's okay to get it wrong because nobody else in the world has done it. And we're going to learn, and we're going to set the path for everybody else. During the pandemic, we saw our mortality rates go up. Are we going to sit by and watch that happen and say we can't do anything about it? No. We created an algorithm right during the pandemic. We deployed it that predicts within the next 48 hours if somebody's going to die or go to the ICU. And we had it alarming our clinical teams whenever it reached a high-risk threshold. And we were able to show a 26% reduction in unplanned mortality. Did we wait around? No, there was a need. We took our time to model it carefully and thoughtfully. We spent a lot of time silent testing, making sure that the data pipelines didn't fail, that the models didn't degrade over time. And we said, we're going to make a call and we're going to deploy it. Thankfully, we saw these impacts that we're seeing.
I see great promise for AI to impact the care that's being delivered at the bedside. It will help provide superpowers to nurses and clinicians. It will help them understand the full depth and breadth of that patient journey, not just looking at how that patient's feeling today and today's vitals, but really go all the way back to the beginning to understand that patient.
If we can use AI to be able to reduce avoidable deaths, to be able to improve the quality of care, to be able to catch cancer and other challenges earlier by using image segmentation to be able to make better decisions, absolutely. You have a ton of data and you have a use case that can directly connect the clinical realities to what the predictions and insights that AI can give. And that sometimes is the biggest challenge, is connecting those sometimes disjointed things. But if you can help to predict this patient is at high risk of a particular ailment and intervene earlier, that's a logical connection.
The recent advancements in AI algorithms has helped a little bit removing that layer of skepticism that were around. Do these AI algorithms work? Are they accurate enough? Are they performant enough? In healthcare specifically, adoption of AI is a little slower, and for good reasons. There are security, privacy, regulatory requirements that we need to meet, and we don't have clear answers on all of these fronts. So we need to still learn more about what is a safe way to deliver an AI solution at the point of care. We need to make sure that we are doing it safely and securely, and I think it's a good enough reason for all of us to be a little more cautious.
Regulations will come in. I think regulations are necessary and helpful. When you don't know the bounds of that box, it hinders innovation. So I would encourage Canadian government and the global community to put very clear regulations around AI and strong safety measures that are aligned with society's expectations.
Yeah, I think people who are going to be left behind are the ones who actually don't invest in the resources, time, or the education needed to actually drive this forward. I think for the healthcare sector, where we're still in the era of fax machines, we're a slow-moving group with a very deep-rooted culture in doing things a certain way. It's so hard with the resources that we have, the infrastructure that we have, the mindset of we can't change because we're too busy, we can't think about it, and we don't have the time and resources. And yet we spend incredible amounts of money on things that we don't even evaluate that we know aren't working. I think what Canada needs to do is look at not only what other countries are doing in terms of consolidating the very rich data assets that we have in a meaningful way. With the vision towards AI, we need a lot of education. And I would say the second thing that we need is courage. We're often afraid to change what we do, and I think that's a problem. We have to step back and reprioritize and reassess.